Hello, is it Mr. Alex Stibbins?
Yeah.
Hello, my name's Dr. Dorothy Newton. I'm one of the psychiatrists working on the ward.
Hi, Doctor.
Is it okay to call you Alex?
Yeah.
Thank you, Alex. I've been asked to meet with you to think about what has been happening in terms of your mood and to consider whether there are any other treatments which might be helpful to you. Is that okay?
Yeah.
Okay. I understand that when you first came into hospital, it was because your mood seemed high or manic. Could you tell me a little bit about that, please?
Yeah, well, I found out since they said I had a manic episode. From what I can remember, like 2 weeks before I came in, I don't know how my girlfriend put up with me. I was having all these ideas. I wasn't sleeping. I wasn't eating. I remember bursting into a meeting at work with some idea I had, and I mean, it all seems like nonsense now, but at the time, so then 6 weeks ago, my girlfriend brought me in, and then I was here. They put me on risperidone, is it?
Yes,
I was
risperidone.
on that for about 3 weeks, and that was working really well. I felt my old self again, and then they were talking about discharging me, and you know, and then I don't know. I woke up one day and I just couldn't see the point. I didn't of anything, you know.
I'm sorry to hear it's been so difficult for you, Alex.
Yeah.
So if I've understood correctly, you had a 6 week period where you were in hospital, and prior to that, your mood before you came in had been very high. So you weren't sleeping well, you didn't feel the need to eat, you had a lot of racing thoughts.
Yeah.
And you were treated with risperidone, which you felt helped you get back to your normal self, but actually more recently your mood has really dropped.
Yeah.
Yeah.
And then they put me on an antidepressant, sertraline, I think it is.
Yes.
I'm on like 150 milligrams daily. I've been taking it every day, but I mean, it's been about 3 weeks now, and I just still feel...
How are your energy levels?
Just on the floor.
So low energy levels in your sleep?
I am sleeping, but even if I've had a good night's sleep, I just feel tired. I don't feel like getting out of bed.
What about your concentration, Alex?
I just can't. No, I can't. You know, I kind of miss the energy I had when I was manic. I mean, I know it seems odd, but
it's been a big change.
Yeah.
Yes. And I need to ask this question. It's important to know how best to support you going forwards with your mood. Do you have any thoughts at the moment about wanting to harm yourself or end your life?
No. I mean, that said, I can't see the point why anybody would put up with me. I don't seem to be of any use. But no, I'm not suicidal, if that's what you mean.
So just to summarise, and again, if I've got any of this wrong, please let me know. You've had a history of several weeks of manic mood, elevated mood, followed by treatment with risperidone. So there was treatment with risperidone which you felt was helpful, got you back to your normal self, and then your mood dropped. It does sound like you have a period of severe depression at the moment following on from that. There is a diagnosis, Alex, which would fit with both of these mood states, if I can call them that. It seems that you may have an illness called bipolar affective disorder. Have you ever heard of that?
I've heard of bipolar,
Okay.
but I don't want to go through the rest of my life like this.
No, of course not. So we'll think about some treatment in a moment, if that's okay with you. It seems very much that the depression you're suffering at the moment is in the context of bipolar affective disorder. So you're having an episode of bipolar depression. In terms of the diagnosis, it would fit with the diagnosis of bipolar affective disorder because you have had an elevated mood for longer than a week, and you were, high in your mood, manic in your mood for most of the days within that time. In terms of treatment, you say that the risperidone was helpful when your mood was high, but the sertraline has, despite having taken it, doesn't feel to have moved your low mood.
Doesn't seem to have done anything.
Okay, yes. If I go to the risperidone first, it is not what we say the first line of first choice of treatment when somebody's mood is low with bipolar affective disorder. So in bipolar depression, we tend to look at two other antipsychotics called quetiapine or olanzapine. The antidepressant you're taking, the sertraline, clearly you've had it for some time, it doesn't seem to have been helpful. The sort of the first choice antidepressant for bipolar depression would be fluoxetine, but it is in the same sort of family of medication as sertraline, so we need to think carefully about whether a change would be helpful there or not. There are other medications which can be helpful in bipolar depression. For example, lithium or lamotrigine. One or other of these medications can be added to what you're already taking and to help with the improvement of your depressive symptoms. Lithium is a medication which requires regular physical health checks and regular blood checks, and lamotrigine also would require ongoing monitoring, including physical health monitoring. But both can be helpful additions in order to improve depression symptoms.
Okay.
In addition to medication, psychological therapy may also be helpful of an intensive nature, and I'm wondering whether, for example, interpersonal therapy might be helpful for you. I don't know whether that's currently available on your inpatient ward, but I think it's definitely worth us exploring that as an option.
Okay, yeah.
And finally, there is also a treatment called ECT or electroconvulsive therapy, which has proven to be very helpful and useful in reducing depression symptoms in people with severe depression, which may not be responding well to other forms of treatment.
Okay.
If it's all right, Alex, I think it would be helpful if we could meet again soon in order to think about the treatment options. It'll give you some time to consider what you would like to happen, and I'm happy to give you any written information that you feel might be of benefit in that time to help with your decision process.
Okay. No, thank you. Thank you very much, Doctor. Really appreciate that.
You're welcome. Thank you, Alex. So in this station, you need to find a really clear balance between obtaining sufficient history in order to clearly make a diagnosis and then moving on to cover the different treatment options which are available. It's really important, in fact imperative, that you're very clear in stating that the diagnosis is bipolar depression in the context of bipolar affective disorder. If you don't do that, you won't pass the station. In terms of management options, again, the emphasis here is on options. It's going to be really unhelpful and will affect your passing the station if you focus on only one treatment available. It's going to be much more helpful and you'll get a much better mark if you're able to explain a range of different options available, including psychological therapies, for example, and demonstrate that you have good knowledge of the NICE guidance around management of bipolar depression.